We're here with Dr. Cunningham, and he is going to work on Jill's legs. Why don't you explain what's going on here?
Well, we've actually already done a couple of treatments on Jill's legs, and what happens is I inject some medications into the veins that causes the vessels to be irritated, and then the body will step in to heal the irritated vein, and it's in the healing that the veins shrink. Because it's a healing process that occurs gradually over time. It's not an instantaneous reaction. So this, in fact, we just did a treatment a couple of weeks ago, so this is that early phase before these vessels have had time to resolve completely. So there's a little bit of trapped blood and darkness and bruising, and that will go away. And as that goes away, it'll look better.
Okay.
But there are still a few little small tiny vessels here, so we want to try to clean those up too, just try to make it look a little bit better. And we're going to do some injections.
I'll just stand here and watch. So what do you inject in there?
That's a good question. In this particular case, it's a surfactant, which is just a fancy word for soap.
Soap?
So this is soap.
Soap?
Mm-hmm.
I didn't know that.
You didn't know that? Are you sure we didn't mention that somewhere along the way?
Probably. Just blocking it out.
All right, here's a pinch.
Okay, Jill, did that hurt?
No, I mean you just feel like a little tiny prick.
Mm-hmm. And there'll just be some spots that are more tender.
And sometimes, like I said, he'll hit a nerve and that'll be a zinger, but...
So you can just see that flushing effect.
Mm-hmm.
But that's, again, that too is an illusion. I mean, the vein isn't gone. All that's happened is the clear solution is going into the vein and pushing the blood out. It's the blood that gives the vein its color.
And you said these are ones that you've already treated.
Right. The ones I'm injecting now are some of these little tiny red ones that are left over. These bigger ones that have already been injected, they're closed. And what's making them dark is there's a little bit of blood trapped inside, which is which is totally harmless. But it does darken and like a bruise. And so you get these sort of bruisey lines, and that's the vein. And then what will happen is this will the blood will get reabsorbed, and the bruisiness will go away, and as it does, then the little dark lines will fade. And so over the next few weeks, that'll look a lot better. Jill, we don't have much left in the way of targets here.
That's awesome.
That's good news, isn't it?
And Jill, you were saying that, you didn't even really wear shorts or short skirts or anything like that.
No, I had totally stopped wearing anything short that would show it. It's just something that I just did not appreciate, anyone seeing my legs at all. So I just cover up.
Yeah, it affects people's quality of life. Even little veins. It doesn't have to be just the big varicose veins. Even just treating spider veins, people feel a lot better about the way their legs look, so they wear more clothes and different shorts and
even in the summer
go
when
in the
it's really
swimsuits.
hot.
That's right, because a lot of times they'll cover them up.
Quick question to ask you.
Sure.
And if somebody's wanting to do this, what should they look for in a doctor?
Well, the most important question is how long have you been doing it? How many have you done? How many do you do? Because there are some doctors that dabble in it a little bit, and they'll do a few treatments a year.
Oh.
And I don't know that I want them doing my veins. So, it's important that they do a lot of these. So I've done these for 20 years. I've done thousands and thousands and thousands and thousands and thousands and thousands.
I got Dr. Cunningham's name through girlfriends who have done it, which is what we do. Is we, girlfriends share the best of everything. So, after you hear a name a few times, you're like, okay, that's definitely who I'm going to call. So that's how I found Dr. Cunningham.
And that's how we get most of our patients. Most of the patients just come from word of mouth and other patients.
Awesome. So Jill, what do you think? This was your third treatment.
Well, I am enjoying the results so far, so I'm definitely going to go through all the treatments and make sure that I get, there is a little bit of pain involved, so I want to make sure I get the best result from going through it and the time element. So, of course I'm sold. And now you know how vain I am because, obviously, it was affecting my quality of life. So I'm excited about the end result, and if you have any questions and want to know how my treatments are going, you're welcome to email me, and I'll be glad to answer any questions that I can. And what I can't, I'll send you to him.
Send them our way.
All right. Well, thanks, girlfriends. There's a little bit about getting rid of those veins on our legs we seem to get over time. And you said it's not, because I'd always heard, don't cross your legs, you'll get those varicose veins. It has nothing to do with it, right?
It's genetics.
Genetics. And it just happens as you get older.
Thanks, Mom.
Yeah, it's Mom's fault. It's genetics, hormonal influences. Those are the two big ones.
Gotcha.
So even though there's genetics involved, if you look at brothers and sisters, it's the sisters who get it because they have the hormonal effects. The female one,
Women and
progesterone.
hormones?
No, Lord, no. Anyway, there's all the scoop that you wanted to know.